Hello, good morning. Hello, everybody, and welcome to this first webinar for C4N and NIPN. This will be the first, but in the next month will be other webinars also that we hopefully will be very interesting for you. The presentation will be done in French, but there is possibilities for translation using the Interactio that you already seen in the first slide before. Today's webinar is about sharing experience in the two NIPIN countries in training and using life-safe tool, also known as LIST, for strategic planning and impact evaluation. The countries that will present the experience are Ivory Coast and Burkina Faso. Ivory Coast will explain the for strategic planning and Burkina Faso for impact evaluation. These two experiences will be introduced by a presentation of the list tool by a C4N and NIPIN consultant on behalf of the representative of the list team for Johns Hopkins University. That is the one developing the tool. And the agenda will be as follows. General introduction to list by the Johns Hopkins University representative. This will be followed by a Ivory Coast team presentation, then Burkina Faso team presentation. After these two presentations, there will be about half an hour of questions and answers. And finally, we will do the conclusions. The objective of this webinar is to introduce LIST to the participants and to share the main lesson learned between the different countries. Yusuf Keita, which is a C4N consultant, will do the presentations. Floor is yours, Yusuf. Thank you to all attendants.
Of this presentation is to make a presentation on what had already been introduced by Tatiana and what would be considered as a tool for the life-saving, meaning that at least is defined as a multi-cause model for mortality, which is making use of data of the health of state, which is very specific in the country for the targeted. First of all, we are using the different intervention people, so women who are in status of giving birth as well as children, the different also infantile diseases, very much like pneumonia, diarrhea, and pneumonia. The majority of women which are exposed to the plasmodium, as well as also rate of growth, whatever is being done. Now, LIST is also making use of certain interventions which are impacting these health issues at the basis through certain interventions, and the efficiency of which is being carried out. So the change of the covering of these interventions, which is very specific to the diseases, is going to give rise to a change in this type of health issues. So the aim would be to estimate the number of lives which are going to be saved consequently to the increase of the coverage of this type of interventions. De facto, the number of the diseases could be avoided, as well as the rate of mortality, to reduce also the reduction also to chronic malnutrition, primarily children who are aged less than 5 years. So the objective of the least immediate objective, that is, first of all, would be to estimate the number of lives that could be estimated when new interventions are being carried out or whenever the coverage of this intervention is increased, meaning this can be translated by again due for the reductions. If, for example, it is malnutrition interventions, which happens to have a certain efficiency on chronic malnutrition decrease, notably on children who are aged under 5 years. Decision taking needs to be promoted based on evidence in order to help the planification for the decision making which is related to the increase of coverage of interventions, whether it is for children under 5 years or mothers. It could be also for several other reasons, reduction for mortality, as well as it could be related to the decrease of the rate of chronic malnutrition, and that is primarily for children under 5 years old. Now, as you can see in the slides, list happens to have a historical background, and this had been also published. We are losing the gentleman, I'm afraid, in 2003 within the framework of the Lancet series, and at the basis it was to estimate the impact for the increase of the intervention coverage which was provided within the community of children under 5 years. It was the very first use of list. Later on, the interventions were within this health center, as well as the natal and the factors of risk that were added to the list. And also later on, list had also been carried out in the public sector by integrating spectrum software. For those who are already familiar with that, whenever you could have access to that, you can open this type of software and you can select a list among other several models which are also presented in this spectrum. And list had progressed by integrating the outcomes at the birth, as well as mortality, maternal mortality, as well as morbidity, because of the pneumonia, diarrhea, and many other also diseases at the level of children who are aged less than 5 years. And then they have carried on with their path within the progress. Modelizations had been also carried out, or the modeling had been carried out. At the very beginning, modeling at the level of one country, we couldn't move, and the need and the possibilities to go towards this type of modeling for in a certain country were added, and even more, the possibility to carry out an analysis, meaning 20% of the population which are richer, or the 20% which are the poorest, have also been added to this tool, as well as a cost estimation. And very recently, there has been the possibility to make use of list through a web platform, which is making its use much more easier. Indeed, the only problem, however, is the availability of good connections. And currently, we have also adding health of the teenagers, which is not available yet, but they are working on that. And a few months period, we certainly be able to have also the impact of the intervention on this issue. Let's move on to the next. Now, specifically speaking, with respect to these, what seems to be most important recently, the efficiency of the nutritional interventions, as well as the stages of the birth at the basis, meaning when there is a newborn baby, whether he is born with a stational weight, or they can also be prematured with a weight which is could with a weight which is rather high. So the state of birth happens to have a huge impact on health, as well as the development of children, which are related primarily with the status of whether to could develop or not later on within the framework of chronic malnutrition. So the risk is very much linked to these outcomes at the birth, meaning now we could also estimate the gain in social capital, meaning the number of years of school year, as well as the revenue which is gained all the way through the life, which is related to the reductions of growth. This is an intraplus for the use of this next slide. If you could kindly ask the gentleman to go to reduce the speed. So roughly speaking, how we can make use of this? Why are we making use of at least currently it is being used to do three types of analysis. The very first analysis would be to achieve the prospective analysis in order to anticipate the potential gains of the implementation of a given program by providing some information to the decision makers on how we could set up certain intervention, but in the same time and primarily how to allocate the adequate resources within the context of a country which are concerned by this. This would also enable to do also this retrospective analysis, meaning that we have implemented a program and this program have been implemented in compliance with the. If you could please slow down a little bit. I was told that you need to slow. No, for the internet connection, I don't know whether we can do anything, but I'm going to slow down. So I was stating that there are three main analysis type which are possible with the list. The very first one is prospective analysis, meaning by doing this type of planification, we try to plan programs with certain interventions which happens to have an impact on the different diseases of chronic malnutrition, women's, mothers, as well as children who are aged under 8. We also try to estimate the impact as of the different targets, whether for the mortality, reduction of the mortality, or else the decrease of the rate of chronic malnutrition, as well as the life that can be saved, as well as chronic cases that could be saved if the objective are being achieved. So this would enable us to also provide some evidence to the decision makers in order to enable them a better decision makings, but in the same time a better also resource allocations. We can also make use of this in order to analyze the of a plan which has already been implemented, meaning that a country had already elaborated, for example, a year for 5 years, a plan, and it had been implemented. So we can make use of this in order to set up a model of the impact of change that they have gone through within the framework of the intervention during the 5, 15, 10 last years on the reduction of the mortality rate, on the reduction of chronic malnutrition for children who are aged under 5 years. This can also be used in order to do some advocacy at the global level as well as worldwide, national level, or even within a very specific region by highlighting, showing the interventions which are going to be used in order to maximize the impact on a given cause. And this would enable then the decision makers to achieve the objectives indeed. Now, you need to know that list is being used by quite a big number of stakeholders, international organizations, as well as NGOs, non-governmental agencies. We have also certain governments which are making use of list, and I think that list needs to be upgraded by adding countries very much like Burkina Faso and Ivory Coast, the two countries which are currently using LISTA, and also taking into account the different decisions which are taken at the level of the nutrition, much more precisely for the issue related to the malnutrition, chronic malnutrition. This is also being used by university. Currently, 4 universities are being acknowledged as making use of this on regular also basis during the lectures that are given to the undergrad and postgrad, as it's been stated by Tatiana, where this had been developed. And the University of Agasan, as well as London School of uh, University of Bamako, where they have been making use of this for 5 or 6 years. Now, this slide is also showing us globally how it is being operational. It's very simple. What can LIST do? They take into account the mortality per cause. whenever we select the children who are aged under 5 years in a country which are being also concerned by the use of list, you could see that they are born because of the main causes whenever we take into account a country like Ivory Coast, for example. Diarrhea, paludism, as well as pneumonia would come up at the very top list on the main causes, meaning that the list would take into account this repetition of the different dead diseases for children, that they would multiply by the change of the coverage of the intervention, which is impacting these causes of death, multiplied by the fractions affected of this intervention, meaning few also intervention which are being done. If you take, for example, the example of diarrhea, we know that it is at the level of other children who are injured of 7 years. And there is a vaccine against these type of diseases. And the efficiency of this disease is at about 50%. Efficiency is 50%. In order to estimate what would say the number of lives which are saved or the number of cases of malnutrition that we can avoid at the level of children who are aged less than 5 years old. Now, what about the organization of the intervention in the list? So the intervention are available in order to make access easier, and also comprehension would be easier, meaning the intervention are organized according to the different care conceptual price, as well as all the other one which are being provided to women at an appropriate age before pregnancy, and all the other intervention which are provided and offered within the framework of efficiency, losing the gentleman sometimes. So other services which are provided to women during pregnancy, as well as when delivery, at the time of delivery, all the efficiency which are also offered to women which are, who are giving birth after delivery, as when there is breastfeeding, all the type interventions, whether it is promotions, earlier also preventions of breastfeeding, as well also the prevalence of breastfeeding, as well as the preventive, all the different interventions that would enable them to prevent them about certain diseases for women as well as children aged 5 years, in order to prevent them about vaccination against rotavirus and other type of diseases. And at the end, there is also another sector which also is related to other type of curing, also care, which are provided to women during pregnancy, during delivery, as well as to the children for other type of diseases or defined diseases. So this graph shows us the link between the interventions and the risk factors and the main causes of diseases, meaning that you have in front of you the different interventions, and there are only few interventions. This graph is very dynamic indeed, and therefore this is screenshot that you can see here, but when you go into the link, you can find the list of the different org, and you'll be able to have access to this graph that you can customize, and you can also export either in English or in French. And this would enable you to add other interventions on the left-hand side. But you can see that on the left-hand side, you could also see the different risk factors, and the risk factors are also related to a main cause of diseases. This does highlight or shows the model, how LIST has been giving birth to these different results in terms of cases of malnutrition that needs to be avoided. So once you have this type of a presentation, I would kindly invite you to go and visit our website to see how the different risk factors as well as the causes would be interacted in LIST. We have planned some intervention within the framework of LIST in order to, for a one given reason, it might be within the framework of fight against chronic malnutrition for children aged under 5 years, or to reduce the rate of mortality for children who are aged under 5 years. It might be also to reduce the the rate of also the weight at birth for newborn baby, and we could again reach several number of outcomes of result. But the very case that you can see at the top on the right hand side, you could see the all numbers of life that have been saved, but by age group as well and intervention. Meaning, when we take children age under 5, we can classify them as newborn and globally from 0 to 59 months. So LIST would provide us this type of possibility. Together with LIST, we can equally get out all the numbers of the different deaths that we have had within a given country, within a given year, per intervention, and also by age group as well. And LIST does also enable us to get the rate as well as the mortality ratio at the level of the newborn, aged under 5, women, mothers, as well as mortality at the natality. List does also, with regard to nutrition, get the rate of chronic nutrition at children aged under 5 years old, but at the same time, the number of cases of chronic malnutrition that might be avoided given the increase of the intervention, which happens to have an impact on this chronic malnutrition. And you would have also the possibility to export these results like in format of tables or very much like a cheese for a given country for several countries at the same time. So you can export all this data for and also for several regions for a given one scenario or several scenarios that you have also found within the list. So you have the possibility to get all the outcomes within a unique table in a comparative manner.
So list cannot be used when it comes to deciding how to do anything. It's for the target population. It doesn't tell you how to do it to reach the targets for intervention. And the context must be taken into consideration when it comes to interventions. List will not help you with taking into consideration the context. Slide, please. List has many benefits. First of all, you have the possibility to see the impact of several interventions on several causes of mortality. As well, you have access to evidence because LIST uses the intervention only when efficacy is proven when it comes to reduction of cause for mortality or a given risk factor. These evidence are validated, published, and this information is updated regularly. List is free and available in the public domain. Anybody can have access to list and use it. So the data sources in list are all high quality by default. It's a highly flexible tool. It helps you to update for all countries which are beneficiaries of our list. As well, you have the opportunity to bring your own changes in list. If you feel that you have better quality data, you can seize them for your analysis. And it allows you to quickly visualize as well the path to impact and as well to visualize the interventions with the highest potential impact using the missed opportunity tool, which is a very efficient tool for the decision makers. It's a tool which is adaptable to see the impact of interventions, a package of interventions, and several countries simultaneously. There are other opportunities with lists of tools. The tool of missed opportunities, I just talked about it for advocacy, and it's really important. There's an equity tool as well to find out if the richest population, if everybody had opportunity to be covered for the 20% richest population, what would be the impact for the whole population? So you can do this type of analysis As well, you can go into the subnational in a given region, the subnational level. List as well allows to do cost analysis and uncertainty analysis. The pre-recorded webinars are available on the list website, and you will see this on the next slide. You can use that. It's in English and in French. You can access them freely, and it's free of charge, of course. Thank you very much for your attention.
Thanks, Yusuf, for your introduction of this interesting tool. Now we will have the presentation of the experience in Ivory Coast and Burkina Faso. As mentioned before, Ivory Coast will be about planification strategy and will be done by Faustine. And Burkina Faso will be about evaluation of impact and will be done by Pascal.
Thank you very much. So, for the presentation of the experience of Côte d'Ivoire, we will rely on this plan and we will present how we managed to this opportunity of training with the preparation phase and the mobilized resources and the training process, the scope and the potential impact, and eventually will be the next steps. So for the case of NIPN, we had to ask ourselves this question: what is the contribution of the coverage rate of ANGE and of the growth monitoring interventions in reducing the prevalence of chronic malnutrition in the coverage areas of the first contact facilities and social centers from 2012 to 2019. Within this analysis that we used, we realized that it was a question that needed list to treat it, to process it. This is why we had this training. So the Ivory Coast is about developing its new plan of nutrition. And it's an opportunity to see the most efficiency and to see how would be the best impact and to develop this plan. This is how we had this question to orientate it in a more prospective way. So, which realistic nutrition intervention packages can guide policymakers in the development of the next multisectorial nutrition plan for maximum impact on reducing the rate of chronic malnutrition in children under 5 in Côte d'Ivoire? Within this context, we had to prepare this training for 4 weeks. And the main objective was to develop several scenarios, and therefore we needed to determine a basis year of 2022, and then 2026 would be the end year. From this, we defined the objectives according to the evaluation of coverage rates with the various investigations, and we did a mapping of necessary data about the various care with pregnancy, breastfeeding, and this allowed us to see what are the actors and to obtain the information for. Therefore, several sectors were associated and as well several data were collected like national inquiries or and as well a health report. Another element is about the preparation of files, projection files with some assistance. We were assisted with this. We had to finalize as well the training materials, and this whole process was supported by a quality control led by a consultant based in Yasu, and he intervened not only during the preparation but after the training preparation, to make sure that the data was absolutely correct and updated. So to reach this, many resources were mobilized. Technically speaking, we had the support of three consultants, the C4N consultant in charge of training, another consultant for training support, and a consultant in charge of quality control. Nationally, several actors were mobilized, especially the executive secretary of CONAPE, and for childhood as well. This structure is very important in Ivory Coast and the Ministry of Planning and Development as well. When it came to financial resources, the platform covered the logistical cost of organization, and the GS gave some support for the cost of the international cost. When it comes to the course of or the process of training, well, when it came to preparation, we had several challenges and we need to bring some answers. First challenge was the lack of recent data for national surveys. The last national surveys of the mix 2016 was used, whose indicators were used for the base year. There is a current survey at the moment, and we will see how we can update, and we'll see about the projections. To face this challenge of data quality, we use several means. The second challenge was the definition of targets. We relied on observation of trends from national surveys on the mix 2006 and the DHS 2012 and the mix 26. But there was an improvement of 25%, and this increase was used for our first scenario and etc. the others. The third challenge was about selection of appropriate interventions. So for a given concept, there is several interventions that can be used. So we need to make sure the right intervention, matching intervention. And we used the use of dictionaries of indicators to define denominator, the method of calculation, and other information. And the last challenge, since NIP relies on intervention which are um, proven evidence, we realized that this was limited when it came to some sectors. And essentially, it was for the health field that we have several interventions that were able to be fed when it came to information. For the scope, so all these helped us to build 6 scenarios based on availability of the intervention in Ivory Coast, the current implementation status, and those which are not implemented. As well, the existence of evidence on the intervention when it comes to effectiveness and fraction affected, as it's been said before, and the average level of change in intervention coverage estimated from the 2 available surveys in the country. All this allowed us to implement the intervention. The first scenario is about interventions already led in Ivory Coast, and it's the scale plus 25%. The second scenario is intervention in Ivory Coast, and for the scale of plus 30% for the third scenario. As you understand, it's the same interventions in Ivory Coast, but this time we go to the plus 40% scale. When it comes to the fourth scenario, we're talking about interventions already led in Ivory Coast. So it's the scenario number 1, and we add the interventions which are not led yet in Ivory Coast, but they are proven and they're quite significant to reduce the rate of chronic malnutrition. And then it comes to scale 5. And for the fifth scenario, it takes again the 30% scale scenario of coverage, and we add the intervention which are not led yet, and it comes to 10%. And for the last scenario, we take the scenario number 3 and we add the intervention which are not led yet with a 15% scale. And then we had results that are presented here. When we take a given scenario, we notice that from one year to another, the case of averted malnutrition cases are averted. So we're talking about, we count only the intervention in intervention. We take scenario number 6 and the intervention which are not led yet, and we take the 15% scale and we get to 15,000 of averted malnutrition cases. And for those who are led in Ivory Coast, scenario 1, 2, and 3 as a total from 2,000 to 6,000 from scenario 2 to scenario 3. But when we take scenarios which are not led in Ivory Coast, we realize that the increase is more significant. For example, from number 3 and 4, we have a jump of 1,000 cases of averted case, and from 4 and 5, we gain more cases, and this helps us with the potential about intervention which are not led yet in Ivory Coast. When it comes to the feedback for the training, the tool was judged as very practical and relatively easy to use, and the expectations met with regard to the identification of effective intervention package were good. So that's very important for the intervention in Ivory Coast with all the indicators at the national level and all the interventions which are not led yet in CIV. When it comes to the next steps and the exploitation of results, well, we need to make a proposal which would be quantifiable for policymakers in the development of new nutrition and early childhood development plans. There would be several stages. Our stage is about training in the costing to evaluate the cost of intervention for the various scenarios we have proposed, and then to have a training in policy brief development and evidence communication. And in April, we will have something else as to develop policy notes as well to edit the analysis reports in April 2022 and cost analysis. This is it. I finished with my presentation. Thank you very much. Hello, everyone.
Bonsoir, selon votre situation
Or good
géographique.
evening, wherever you are.
Effectivement, donc je vais
Indeed, I will,
en quelques minutes faire
in a few minutes,
partager l'expérience du Burkina Faso par rapport
present the experience of Burkina Faso
que nous avons
and
bénéficié
as
au
well
cours
about the list
2021.
training, and we
Mais
benefited
en
of
ce
this,
cours
benefited of this in 2021.
Donc pour le plan de cette formation, nous aurons
So
quatre
for the
points
plan
clés.
of this
Donc le premier
training,
point
we will
est
have
relatif
4
aux travaux
points.
préparatifs
First,
pour
the
la
third
formation.
point is about
Le deuxième point,
preparations
donc
and the
l'analyse des
conduct of the
résultats.
list
Donc
training.
cette
Number
formation
2,
a été
feedback on the
accompagnée
training,
d'une phase pratique.
because
Donc
there
on a
was a
utilisé
practical
un document
phase and we used a
de
document
référence qui est utilisé au Burkina Faso pour
which is already existing in
faire
Burkina
la phase pratique
Faso
de la
for
formation.
the practical phase of the
Là, je vais revenir
training.
sur les résultats auxquels nous sommes aboutis.
And
Le troisième point,
we have
donc,
some
sera
outcomes.
faire
The
un
third
ressenti,
point
les
is
ressentis de la
about
formation
the
et en deuxième
feedback
position,
on
nous allons
training.
aborder ensemble les prochaines étapes pour
And the fourth point is about the next
les résultats et puis
steps
aussi pour la formation que les différentes parties prenantes ont bénéficié.
for the various stakeholders.
Donc, si la cadence est bon, si c'est trop rapide aussi, parce
So
que
why this
disons que
training
le
in
Burkina Faso,
Burkina?
à
The
l'instar
Burkina
de plusieurs
Faso
pays dans le
actually
souci
is concerned
des engagements sur le plan national et
with
international.
a national and international
Enfin,
commitment
concernant une
when it
nutrition
comes to a national
selon une règle
policy
d'une
for
politique officielle,
nutrition. So
mais
there was
elle a
already an
été remue
existing
pour prendre en
nutrition
compte l'aspect
policy,
multisectoriel de la nutrition.
but
Donc, ce qui fait
however,
qu'au
the
Niger, on fait aussi des
country
priorités
aligned itself
pour
with the
devenir victime de
commitment and the
malnutrition.
regional and international
Donc,
objectives to fight against
l'opérationnalisation
the
de cette
malnutrition. So this
politique se fera à
policy
travers un
was
document qu'on appelle
operationalized
le
through
plan stratégique
a strategic
multisectoriel de
plan,
nutrition.
a multisectoral
Ça
strategic
fait
plan
très
for
rapidement. Ce
nutrition.
plan a été
So
subdivisé
it's
en
the
deux phases.
MSNP.
La première
So
étape
that
en
was used
2020-2024
initially.
et maintenant,
It
ça serait
was
revu à partir de 2024 pour prendre en compte les différentes
up to
insuffisances et
2024
pour
to
la
fight
dernière phase qui est de
against
2024-2029.
the shortcomings,
Ainsi,
and
donc,
even up
dans
to
le cadre de la mise
2029.
en place de la
Within
plateforme
the
multisectorielle de nutrition,
implementation of this
donc,
platform
dans la
in
première
Burkina
phase, cinq
Faso, in the
participants
first
ont
case, there were
décidé
several
donc
stakeholders,
d'évaluer
and
l'impact
we decided to
de ce plan
assess
stratégique
the impact
sur
of the strategic plan
la malnutrition chronique chez les enfants
on
de moins de 6
chronic
ans.
malnutrition
Donc,
for children under
pendant
5.
le premier cycle opérationnel,
So in the first
plusieurs questions ont
operational
été formulées,
cycle,
mais
several
l'évaluation
questions were put on
du
the
plan
table,
stratégique faisait partie
but
de cette
the
question
development
qui
of
ont
the
été retenues
strategic
par les différentes
plan
parties
was
prenantes pour
part
la
of
mise en place de la
this
plateforme
to implement the
dans le processus
platform
des analyses.
in the
Diapo,
process of analysis.
il nous a
So
fallu
for
pour cette
how long?
formation.
How long
Disons
did we
que
need
au
for
Burkina
this
Faso, bon,
to
premièrement, la
prepare
formation
this?
était prévue pour
To prepare the
le mois de
training.
mai.
Initially, it
Et
was
donc, ici,
scheduled
nous avons
for
commencé dès
May.
mars
So we started in March
le processus pour
this
se mettre vraiment
process.
dans le temps. Mais il s'est avéré dans cette
But
première phase que
in this first phase,
quand nous allons réunir tous les documents
when
nécessaires,
we gathered all
surtout
the necessary
le document du plan
documents,
stratégique multisectoriel, en
especially the
voulant
strategic
revoir
plan
tous les indicateurs qui
document,
y sont.
we needed all
Donc, il
the
s'est avéré qu'au
indicators.
moment de l'extraction, il
And
y avait
we
des
realized
indicateurs
that
qui ont
when it
été
came to
déficients. Donc,
extract
nous avons constaté
information, there were
qu'il y
some
avait des niveaux de
shortcomings.
base et
For the
il n'y
basic
avait pas de niveau
level,
de référence
there
d'ici
was
2024
no
pour
reference
2024. Si les
level
indicateurs avaient
for
été cibles pour
2024.
2024,
We needed
il
a
n'avait pas de niveau
target
de
for
référence
2024. There
pour
was no reference level.
2018 ou bien 2020. Donc, ce qui fait qu'on était
So
obligé
we
de
had
suspendre le processus
to
afin de
hold
permettre aux
on
différentes
the
parties prenantes
process
qui ont
to
élaboré
allow
les
the
différents
various stakeholders
documents
who
de se
developed the
réunir pour
document to
finaliser ce
gather
processus, donc
together
pour
and
corriger certaines
finalize this
insuffisances.
process
Donc,
and
pour
make
ces
some corrections
indicateurs,
about
on
these
puisse avoir
shortcomings.
tout ce qui est comme niveau de base et puis
So to
cible
have
pour la
a,
période 2020-2024.
a
Donc, ce qui fait que dans ce
basic
processus,
level.
on a
And within
dû
this
suspendre.
process, we
Donc,
had to
par finir, la formation s'est déroulée
hold
dans le mois de juillet.
this
Mais il faut
until
dire qu'à ce niveau, bon,
July.
si on prend en
So
compte
if we take
le
into
stade de préparation
consideration
jusqu'à
the
ce que les parties
preparation
prenantes se réunissent
stage
pour
and the
finaliser le
stakeholders
document,
had to gather
il
together to
était que nous puissions
finalize the
avoir des
document,
indicateurs
to have
bien
indicators
clairs avec des objectifs
clear
et des niveaux de référence
with clear
et
objectives
le tout
and reference
on
levels
cumule en gros un mois. Ça veut dire que bon, la formation a
for
été
1 month.
initiée,
So
mais
the
juste après
training
que
took
les
place in
parties
July
prenantes ont corrigé le document, on pouvait pas
after the
immédiatement
stakeholders were able
reprogrammer la
to make
formation.
some corrections
Puisque
on the
le consultant
document.
était,
The consultant
n'était pas disponible,
was
donc
not
on a dû
available,
ramener
so
la formation dans le mois de juillet pour dire qu'en principe,
we
un
had
mois suffisait
to
pour préparer
postpone
tout pour la formation.
the training
Donc,
for
par rapport au
July
coût, donc,
as well. When it came to the
naturellement, pour une
cost,
formation, il
of
faut
course, for such
une salle,
training, you
mais
need a room,
particulièrement pour
but especially
la formation sur le processus,
for
il
the
faut forcément un cadre
training,
qui soit
you
vraiment
need a
bien
framework which
tranché
is
pour que
very
la formation, donc
quiet
avec une connexion
because
bien
with good
fluide
connectivity,
et
of
puis aussi des
course,
participants aussi qui soient bien
internet
suivis. Donc,
connectivity,
si
and
dans la
with
formation, si tu veux prendre
participants who
une heure de
follow
retard
very
au Niger,
well.
tu vas trouver que vraiment
So all these factors were very
tu n'es plus
important,
en phase par rapport à ce que tu veux. Et aussi,
and
plus quelques moyens logistiques comme
some logistic
projecteur et
means were
imprimante pour pouvoir
necessary
effectivement imprimer les
as well
documents pour
to
partager aux
print
différents
the
participants. Et puis
documents for
aussi,
the various
donc, tout naturellement,
participants
cette
as well.
formation a nécessité des coûts.
This
Des coûts. Donc,
training
pour les consultants, c'est
implied
aussi
some
foreign pour les
costs.
amis,
For the
les consultants à disposition
consultant,
du Burkina
it
Faso.
was
Et
covered for
aussi,
Burkina
il y avait aussi
Faso,
un assistant
and there was
consultant
an
pour
assistant as well,
l'information.
a
Et il y
consultant
avait
for
aussi un
information,
chargé
and
d'assurance
as well
qualité.
a
Donc,
responsible for quality
qui a
control
appuyé à la formation
So for the overall success of the trainer. So all this logistic aspect was covered and the financial aspect had to be covered to finalize the training. For the first cycle, for the question, there was a question that was put with all the consultants. The question which was retained initially was not really sure about the training. It was not possible. So initially, the question was, what will be the impact of the implementation of the nutrition action plans on the number of cases of chronic malnutrition averted and under 5 mortality? That was list analysis. So after 2021, this question could be exploited and used with the list analysis. We had to reformulate this question with objectives, with the list tool. So the question as it was formulated has an objective, but it had to be according to the needs of every stakeholder. So eventually, this is what it became. What will be the impact of achieving the targets of the nutrition coverage indicators contained in the multi-sectoral nutrition strategic plan and available in list at national level on the number of cases of chronic malnutrition avoided, on the number of lives saved, on reducing the mortality rate among children among 5, and as well which interventions will have the greatest impact in reducing the prevalence of chronic malnutrition. So that was analyzed in Burkina Faso at the end of the training and during the phase of the training of list. What was the outcome? Here, the outcome list tools enables to do what? First of all, in Burkina Faso, we saw in the strategic plan over 50 retained indicators. We realized there were only 7 indicators for 7 interventions that we could model through lists. So that was already a very important outcome. So out of so many, we retain only 7 for the interventions which have impact on chronic malnutrition. We use them. I believe there were some indicators and we were able to model them. And through the training, we saw that these indicators were not, it was not possible to model. There were shortcomings. So that was a very important aspect. Out of 50 indicators, we only found 7 usable indicators. They were indicators linked with specific interventions, but they could not be modeled because there were shortcomings. That's very important. With lists, we could see which indicators would have more impact on direct interventions when it came to chronic malnutrition in a given country. So 7 were retained: use of contraceptive for pregnant women, for exclusive breastfeeding, for advice on complementary nutrition, for vitamin A for children, vaccination against rotavirus, and care against severe malnutrition. These were the 7 which were retained. So our outcome, the impact on the name of averted chronic malnutrition cases between 2020 and 2024 list enable us to have predictions about the impact of our interventions. And you can see with this strategic plan, with these 7 indicators, the chronic malnutrition could be averted based on more than 7,800 cases for children under 5. So that's so important. And that would we want to know that what would be the impact of such action to fight against chronic malnutrition. So the result is impact on the number of saved lives for children under 5 between 20 and 24. So we're talking about 6,000 lives for children that could be saved. It's really, really important. And that's on the basis of these 7 modeled indicators, as we already said. 7. And we managed to achieve these results. By 2024, this is a possibility with lists, and that can be used for certain planning to simulate certain results to guide our actions to reach the desired outcomes. It's about the impact on the reduction of infant mortality rate. First of all, through the implementation of such interventions, what would be the impact on the children under 5 mortality? We are 87%. So through the implementation of this tool, we will be able to know in 2024 what will be. And on the second chart, it's for mortality for children under 1 month. And here we will have, you can see that it will be a diminishing curve. It's not so important, but it allows us to see what we can do through the various actions to reduce mortality among children under 5 or children under 1 month old.
Through the different also intervention, this would enable us to have some other interventions on the different resources we will have on the basis, for example, of 7 interventions. This is going to be the prevention of palliatism. We have also pregnancy, which would enable us to save more lives for children, for example, and to save also malnutrition children in Burkina Faso. It would enable also to see where we would need to focus, to concentrate on certain results that we had set up, and therefore this is one of the possibility of at least within our own planification plan, as I was stating, we could forecast, thanks to that, where we would need to concentrate more. So the outcomes of the results, the different stakeholders have already appreciated this training. It was not only theoretical, but more practical than anything else, I would like to say. So these are the outcomes that I wanted to share with you. This enable all the participants to be really within the framework of this training during the 5 days, and also to see how, for the future, what needs to be undertaken in order to have a policy that would achieve the outcomes with regard to the past methods of planifications. So this would enable the participants in the near future to correct certain elements and also the different strategic points in order to achieve their own objectives. So the training was very useful because it went online to the needs of the participants indeed, who from the very beginning of the formulation had shown their interest to have and how to benefit from this type of training. They were very keen on attending. So the main challenges that we come across, as I was stating earlier on, at the level of the challenges, the data represented a challenge. That is a service that would enable us also to correct also certain lackness at our level, and this also was an issue. It is a challenge. Likewise, discrepancies in the strategic plan to deal with before the training agreement related with the sectors, which is requested with the sectors. We need to have certain processes with the different stakeholders. The limited number of the different nutritional interventions that can be modeled with list And I believe that in the future, we are going to take into account all these type of challenges. Now, what about the forthcoming steps? What needs to be taken in the future with respect to the use of this? Unfortunately, the context had shown us that we need to put them in order, and we will be able to the simulation at the level of the decision makers. Likewise, we are going to elaborate also some key message in order to highlight also the outcomes that we have achieved, dissemination also of the results to the different also decision makers and stakeholders, dissemination of the outcomes and the system of information, and different advocacy also is requested in order to take into account the indicators and the different also list that had enabled out a certain type of intervention which is requested, as well as the impact on the chronic malnutrition. And we would know to know then what would be needed. These were the different type of processes. I think that in the forthcoming period, we would have also capacity buildings in order to enable to be really able to be used in a very exhaustive. I think that all these elements will be taken care of are going. I think that it was rather hasty, very quick, but I think that I have conveyed the most important part of my message. So I'm here to provide any type of clarifications. So Kate had been the trainer at Burkina, and he could provide you with further clarification if there is any request for that with respect to the importance of list, and also to say that it has been very beneficial. Thank you for your kind attention.